Hi, I'm Dincy here. Wishing you all a very good day. So we are starting today's topic. Last video we had discussed about acute glomerulonephritis, right? So today we are going to discuss about chronic glomerulonephritis. Acute if it is left untreated, or if it is there is a chance of acute getting progressive, okay, which can lead to chronic, or repeated episode of acute can lead to chronic, okay. That is chronic glomerulonephritis, and chronic glomerulonephritis is the third leading cause for CKD. CKD is chronic kidney disease, okay. Moving on to the definition, it is a condition, okay, it's a severe condition where the glomeruli, it's irreversible. Irreversible means it cannot come back. Once it has happened, that's it. Irreversible condition where there is a rapid reduction of GFR. I'm sorry, GFR means glomerular filtration rate. Okay, there is a decrease, a rapid decrease in GFR, and also there will be retention of uremic toxic substances in our body. Okay, which can lead to chronic glomerulonephritis. Fine. So the etiology already in the introduction only I told that there will be a repeated cause of acute glomerulonephritis is a cause of chronic glomerulonephritis. Fine. Moving on to the pathophysiology. Due to etiological factor, that is repeated episode of acute glomerulonephritis, what happens? Hypertension and hyperlipidemia. Okay, because of that the kidney is reducing the size to one fourth of the kidney size is reducing, okay. The cortex of the kidney shrinks to 1 to 2 mm, okay, and the surface will be irregular, okay. And because of that, scarring and thickening of the kidney occurs because of the severe glomerular damage, which is ending up in ESRD, end stage of renal disease. Okay, pathophysiology, once again I repeat, due to etiological factor, that is repeated episode of acute glomerulonephritis, because of that the person will be ending up in hyperlipidemia and hypertension. Because of that the kidney size is decreased, or kidney is shrinking means size is decreasing, okay. And also the cortex of the kidney is shrinking to 1 to 2 mm. Because of this there is a severe damage in the glomerula, scarring and thickening of the kidney occurs. Because of that it is leading to ESRD, end stage of renal disease, okay. Moving on to the clinical manifestation, there will be swelling in the feet especially, okay, especially in the night times, okay. Then the person will be having increased irritability, poor nutrition, severe headache, okay, weight loss, then loss of appetite, loss of sleep, okay. Then anxiety, what is happening in my body. Because of that then the skin will be like yellowish gray, pigmentation will be there in the skin, okay. Then suddenly there will be a nosebleed. Fine. These all are the clinical manifestation. So diagnostic evaluation, history collection, physical examination, urine analysis will be done. Blood test will be done to know one blood urea nitrogen. Okay. Then biopsy will be done. CT, MRI will be done. Okay. Chest X-ray will be done. Fine. So this all are the diagnostic evaluation. Moving on to the management. See, in the this one pathophysiology, we had told that the person is having hypertension, right? So because of that the person is having headache also, so we will give antihypertensive drug, that is enalpril or captopril can be given, okay. Then we will be giving ARB is like angiotensin receptor blockers, okay. Angiotensin receptor blockers will be given because in acute we had discussed about angiotensin command converting into angiotensin 2 and all, right? So this is blocking it, okay. For example, I can say lazartan can be given, and all symptomatic treatments can be given, like swelling is there for the patient, we can give diuretics also, right? Symptomatic treatments can be given for the patient. Then if symptomatic treatment we are treating and yet the patient is not uh, progressing, then we have no option other than dialysis, okay. Then what can be prevent from this? If the person is having this one episode of repeated episode of acute glomerulonephritis, to prevent chronic, we can maintain the patient's weight, then diet, protein, protein diet we can maintain, and also in the blood test creatine count we can normalize. Okay, then if the person is having a habit of smoking and alcoholism, we have to ask the patient to have a cessation of it. Okay, then exercise, proper exercise should be there, walking and all should be there. Okay, so this was all we had discussed about chronic glomerulonephritis. I hope you all understood, and if there is any doubt, please get back to me. Thank you.